Hello and welcome to 6 Minutes. I'm Michael Woodhead. This week we're in Blacktown in Western Sydney, where the local GP division has been selected to be one of the first Medicare Locals. So what will this mean for GPs in the area? To find out more, we've spoken to Professor Daya Halloran, who's the chair of the local division, and Chief Executive Olivia Wood.
We will keep on working directly with GPs. Keeping GPs well supported, in fact increasing our support to GPs, is still going to be our highest priority. But we're going to be trying to extend that to other health professionals and to help them work more closely with their communities. The more that we can bring primary healthcare professionals together, as we've done in Mount Druitt with Health One and now in other areas, the better it is for everyone. First of all for the patients and the communities, but secondly, importantly, for their GPs and primary healthcare professionals.
And a big part of, I think, what we'll do is be working with the LHN or the LHD to plan with them care coordination for patients that are bouncing into hospital a lot. So trying to keep them well in the community by giving them a supported workforce with the GPs and allied health providers.
I think the fear on the part of general practice is a very reasonable one. Everyone fears the loss of GP engagement, the loss of GP leadership, and for us, they're things that we absolutely have to maintain, and we've made that very clear. We place enormous store on our GP leaders and our community health and other leaders as well, but that's a critical element of the model that we're absolutely determined to maintain and to keep that at every single level, from the board level right down to the local leadership level. What we do know, I guess, is that any fund holding will start in areas where there's an agreed problem, and after hours and aged care are the two obvious ones. So I guess for the next few years we will be developing our own capacity to be proactive change agents holding funds, which is really essentially no different from what divisions have done already. We're a long way off budget holding for a major chunk of our population in the way that the LHN does. In terms of after hours care, one of the major issues is at the minute that there isn't enough of it, and secondly that everyone is doing their own thing. So state governments and hospitals have their emergency departments overwhelmed, so they are developing up alternatives, and that's being done largely in isolation from general practice. The Commonwealth is putting money into after hours services and has been for some years. The viability of those is sometimes in question. Corporate services, locum services are. Despite that, there are still gaps. So I think for us as a Medicare local, the main issue is going to be mapping the need, mapping where the services are, where the gaps are, and working to coordinate and facilitate across this system to plug the gaps and maybe do some future planning as to how to deliver it better in the longer term.
And one of the other crucial elements for after hours care will be education to patients. So we need to look at why patients are presenting to emergency departments out of hours, and can we do anything around presenting problems and work with the local communities.
I think the take-home message is that GPs are the ones who've made divisions as effective as they are, and they will essentially be the ones who will make Medicare Locals stand or fall. Even though we now have an opportunity to engage a much broader group, it will still come down to whether GPs are prepared to play a leadership role and to continue being as generous as they have been.
Well, I'm sure we're going to hear a lot more about Medicare Locals in the near future. I'm Michael Woodhead, thanks for watching, I'll see you next week.